Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Gastroenteritis is a big word, but it means something we all know: an upset stomach. It's very common. Millions of people get it every year. It's usually not serious, but it can make you feel really bad. Gastroenteritis happens when your stomach and intestines get inflamed. This inflammation is usually caused by a virus, bacteria, or parasite. Sometimes it can also be caused by something you ate or drank. Gastroenteritis is especially common in young children, but it can affect people of all ages. It's important to know the causes, symptoms, and treatments for gastroenteritis. This way you can feel better quickly and prevent it from spreading. The most common cause of gastroenteritis is a virus. Viruses are tiny germs that can make you sick. Many different viruses can cause gastroenteritis. Some of the most common include norovirus, rotavirus, and adenovirus. Bacteria are another common cause of gastroenteritis. Bacteria are tiny organisms that live everywhere, including in our bodies. Most bacteria are harmless, but some can cause illness. Common bacteria that cause gastroenteritis include Salmonella and E. coli. Parasites are tiny creatures that live in or on other organisms like humans. They can get into your body through contaminated food or water. Parasites that can cause gastroenteritis include Giardia and Cryptosporidium. Less often, gastroenteritis can be caused by something you ate or drank. This could be food poisoning from contaminated food or a reaction to certain medications. Gastroenteritis usually causes symptoms like nausea, vomiting, and diarrhea. You might also have stomach cramps, fever, headache, and muscle aches. These symptoms can range from mild to severe. Diarrhea is when you have loose, watery stools 3 or more times a day. It can lead to dehydration, which is when your body doesn't have enough fluids. Dehydration can be dangerous, especially for young children and older adults. Vomiting is when your body forces food and fluids back up through your mouth. Like diarrhea, vomiting can also lead to dehydration. If you are experiencing these symptoms, it's important to stay hydrated. Drink plenty of fluids, such as water, clear broth, or an oral rehydration solution. Section 4. Diagnosing gastroenteritis. Your doctor will ask about your symptoms and medical history. They will also perform a physical exam. This may involve feeling your abdomen for tenderness and listening to your bowel sounds. In some cases, your doctor may order a stool test. This test checks your stool for the presence of viruses, bacteria, or parasites. The results of the stool test can help your doctor determine the cause of your gastroenteritis. Your doctor might also ask about recent travel, contact with sick people, and what you've eaten and drank. This can help them figure out the cause and the best treatment for you. It's important to see a doctor if your symptoms are severe, last longer than a few days, or if you have signs of dehydration. These signs include decreased urination, dry mouth, dizziness, and fatigue. Section 5. Preventing the spread. Gastroenteritis can be very contagious. It's important to take steps to prevent spreading it to others. One of the most important things you can do is wash your hands often. Wash your hands thoroughly with soap and water after using the bathroom, changing diapers, and before eating or preparing food. If you're sick, avoid close contact with others. Don't share personal items like utensils, towels, or drinking glasses. Clean and disinfect surfaces that are frequently touched, such as doorknobs, light switches, and countertops. Make sure to cook food thoroughly and wash fruits and vegetables before eating. Avoid drinking water that might be contaminated. If you're traveling, be careful about what you eat and drink. Vaccines are available for some viruses that cause gastroenteritis, such as rotavirus. Talk to your doctor about whether vaccination is right for you or your child. Section 6. Treatment and recovery. Most cases of gastroenteritis go away on their own within a few days. The most important thing is to rest and stay hydrated. Drink plenty of fluids, such as water, clear broth, or an oral rehydration solution. Avoid sugary drinks, caffeine, and alcohol, as these can worsen dehydration. Over-the-counter medications can help relieve symptoms like nausea, vomiting, and diarrhea. However, it's important to talk to your doctor before taking any medications, especially for children. Eat bland foods that are easy to digest, such as toast, rice, bananas, and applesauce. Avoid fatty, greasy, or spicy foods, as these can irritate your stomach. If your symptoms are severe or you have signs of dehydration, you may need to be hospitalized. In the hospital, you will receive fluids and electrolytes through an IV. Most people recover from gastroenteritis without any complications. However, it's important to see your doctor if your symptoms don't improve or if you develop any new symptoms. UMCC, your ultimate medical consultant connectors.